Welcome, everybody. Thank you very much for joining us this afternoon. This is a part of Actsafe's Injury Prevention Week. My name is Will Heller. I'm a safety advisor with Actsafe. This afternoon session will share the latest medical and scientific information around brain injuries and its impact on your mental health. We'll go through best practices in understanding brain injury, sports risk factors, prevention techniques, and concussion management guidelines as it best relates to mental health within the performing arts and production sectors. And with that, I'd like to introduce Philippe Saucier. Philippe is the manager of Sport Safety and Event Services with SportMed BC and the Team BC medical manager. He's worked extensively with youth, amateur, and professional sporting populations, providing injury prevention training, on-field medical coverage, and injury rehabilitation. Since joining SportMed BC full-time in the fall of 2016, Philippe has taken on the role of Team BC medical manager, continued to create sport safety education opportunities throughout the province, and has been delivering medical event services to provincial, national, and international sporting events in BC. Welcome, Philippe. Over to you.
Thank you, Will, and hello to everyone who is able to join either live on Facebook or in the chat here. I'm Lori. It's good to, well, not see you, but to see your name. And Annie, welcome as well. We are going to, I'll do a brief little intro and give a few more minutes for some people to join if they're going to be joining on Zoom here. So a little bit about myself. I'm Philip. I'm originally from Quebec. I did my schooling at Concordia University. I got my bachelor there in athletic therapy. And I got certified as an athletic therapist back in 2007. I've been working in private practice and in varsity setting since then. In the fall, as Will said, of 2016, I started full-time as the manager for sports safety and event services at SportMed BC. SportMed BC is a non-for-profit organization that creates leadership opportunities through sport safety and sport training. And it'll be part of that background that I'll be presenting this afternoon on concussions and the impact on your mental health. So I'm just going to get my screen sharing here so we can all see what you guys can all see what I see. So if you guys have any questions, you guys can pop those into the chat, direct them to Will, and I will connect with him throughout the presentation. I'll also give you guys an opportunity at the end of the presentation today to go ahead and do that. I'll just wait a couple more seconds. Great. So just to start here, what I always like to do before I teach a workshop or a course is I do a quick little Google search on what I'm discussing. And I actually did this, I think on Friday, and I put in concussion and mental health, and these three stories came up. The first one around a cricket player who's dealing with concussion and long-term concussion symptoms, and looking at probably having to leave his team due to those post-concussion syndrome symptoms. And the other news article was actually on a Canadian Rugby 7 player, Jen Kish, who's looking at battling mental illness due to her long history of concussion. So this is and if I was to do my Google search again today, it would give us a bunch of different news articles for sure. And so this is something that's a hot topic. The other two pictures that I have on the screen here, Sidney Crosby and the concussion movie with Will Smith, those are high-profile stories and movies that create discussion around concussion. And when you have a high profile player like Sidney Crosby have a concussion, obviously there's a lot of push and information that's wanting and that's gathered over the years. And so it's still a quote unquote hot topic, specifically now with the mental health piece, which is why we're sharing with you guys today. So just some challenges around concussions and mental health is the first thing is recognizing when a concussion's happened, the lack of reporting that occurs from participants in your field. Everybody responds differently to concussions, and so the management will change, and then understanding how to manage these long-term symptoms, specifically when it deals with mental health, and then when it's safe to return to work. And so those are some of the challenges that I've seen around the concussion landscape. Just a quick outline, things that we're going to be talking about. We're going to define concussions, and then looking at some signs and symptoms. We'll talk about second impact syndrome, and then we'll look at that mental health impact and return to work piece that's so important in your field. So just to define things so that we're all on the same page. Today we're going to be talking about sport-related concussion, but that definition goes across the board to if it's work-related or if it's an other area, that's fine as well. And so the definition that I'm presenting here today is actually from the 5th International Consensus paper on concussion in sport through the Concussion in Sport group. So this is a group of practitioners and doctors and specialists in the field of concussion that gather every 4 years, and they review all the literature, all the scientific evidence around sport-related concussions, and they come up with a consensus paper. And so their first time that they gathered at this conference that they hold every 4 years is a complex pathophysiological process affecting the brain induced by traumatic biomechanical forces. And so that basically means that something happens to the brain, and so the brain can then at that point, it will not work as it should, and so it actually changes the way that the brain processes information. So if you can imagine maybe a mason jar filled with water, and there's an egg inside, that's kind of how your brain sits. So you have your brain, which is the egg, the water around the egg where it floats, that's actually your cerebrospinal fluid, and then you have your skull, which is the mason jar. So if you shake the jar or you jolt it back and forth, you can see that there's going to be impact and twisting of that. And so that stretching and damage can actually create some chemical events and altered cerebral brain flow, which is where you get those symptoms. There's 3 basic types of symptoms. You have somatic, cognitive, or neurobehavioral. Somatic has to do with the body. Cognitive is a mental piece, so concentration, those types of things. And then neurobehavioral has to do with sleep, and then your behavior and emotion. And so that's going to be the mental health piece, is that neurobehavioral component is, and the cognitive piece as well, is where that information is processed and how that information is processed in your brain. And so with these symptoms, the brain then becomes vulnerable to stresses, including cognitive and physical work and those types of things. So concussions shouldn't be dismissed as just getting your bell rung or getting dinged. There's typically a rapid result of those and the onset of those neurological impairments. So those signs and symptoms usually come on pretty quickly. And so appearance of those signs and symptoms might be delayed a little bit, but usually it's up to 72 hours. The newest research now is showing that usually by 48 hours, if you don't have any symptoms, usually physicians will be able to clear you from any concussive episode. And so usually it's that 48-hour mark that we're looking for. The other thing you need to think about is this day after effect that happens. And so any type of injury, be it a concussion or otherwise, usually sometimes you don't feel it the day of, you'll feel it the day after that adrenaline wears off. And then you are, then the next day you notice, oh, I'm going to have a headache, or I'm feeling dizzy, or those types of things. The symptoms of a concussion is that's what reflects a functional disturbance. And so it's not something that's detectable by imaging of the brain. You can't just go to the emergency room and get an MRI or a CT scan to see a concussion. And so that's something that based off of your symptoms and those types of components. It may or may not include loss of consciousness. Historically, people are used to only call a concussion if you lost consciousness. That's not the case anymore. And concussions are cumulative. So they increase, the more you have them, the more you're at risk, and the symptomatic effects are usually typical in that case. And often, if not managed properly, concussions can lead to associated complications. You can go into that post-concussive syndrome, which we're going to talk about shortly here. And then that's where that long-term piece really comes into play if those concussions are not managed properly. So recovery. I put the childs and teens in there just for your information, but generally speaking, adults will recover in a 7 to 10 day period if they're managed properly. There is, as you can see, there's that 20 to 10% that do not resolve, and that's the percentage that we're going to focus on and that I'm going to speak about for the rest of the presentation today. But before we get there, we have to talk a little bit about what to do and how concussions occur. So here you can see in our picture, this is how you get mechanism of injury. Basically, in any direct blow to the head, the face, the neck, the chest, or anywhere in the body that causes an impulsive force to transmit to the brain. And in the film industry, there are lots of other ways that you can get that through a whiplash, rigging, or as a stunt performer. There's a lot of, physicalness that happens throughout filming. And so that's something else to think about. So it could be in training that you can get injured, or it could be as you're filming itself. So for the purpose of today, I will just say film industry as a common umbrella term, but I want to make sure that I represent everybody that's here today. So just these effects again. So we have the physical, the mental, the sleep, and then the emotional and behavioral. So this is where this irritability, nervous, anxious, frustration, anger, sadness, you can also put in depression in here. Those are the concussion symptoms that will usually affect that mental health piece a little bit more. And then the fogginess and the feeling slowed down and those types of things. So these two sections, the blue and the orange or the yellow, are the two sections where those symptoms are going to be a little bit more geared towards that mental health piece. So just to review there, we've got the somatic or physical signs and symptoms, which relates to the body. So headache, pressure in the head, dizziness, vomiting, blurry vision, sensitivity to light, noise, numbness, or tingling, those types of things. And then mental is that cognitive piece. So feeling slowed down, feeling like you're in a fog, difficulty concentrating or remembering details, and then that confusion piece as well. Neurobehavioral or emotional is the trouble sleeping, drowsiness, fatigue, sadness, depression, nervousness, and irritability. So this depression piece, this is the one that we're going to talk about a little bit later when it gears towards specifically that mental health piece. As I mentioned, diagnostic imaging. So there's no specific imaging that, there's no standard to structural neuroimaging around concussions. So there is research going on in new ways to discover and see concussions. So there's a dye-injected MRI, which is an MRI where they inject a dye and they have you, they look for those bright spots on the MRI. Functional MRI, which is in combination with dye injection, but what they end up doing is they have you do a task. It could be as simple as, filling a cup of water, as an example, or picking up a pen from one side to the other of a table. And so sometimes those MRIs, you can see those disturbances or those changes through information processing, which could indicate a concussion. The other ones is a TAU biomarker, which is a protein that occurs in your brain. And that's a pretty extensive test that needs to happen. And so the application for this TAU bar marker right now, there's a group in Calgary that's doing the research around this new way of discovering concussions. But the thought is to have a protein, a blood test done on site, and then they can tell if there's a high concentration of that protein that basically there is a concussion that's present. So in terms of recognition, the current issue at hand is that workers and participants. So I'm going to just use the words participants from now on in regards to actors or people on set, those types of things. People are not reporting their symptoms. Specifically, there could be peer pressure. There could be pressure for production staff. They want to keep performing. They want to appear tough. There's a loss of income piece that you have to think about. And often people just don't know enough about concussions. Now, some years ago, we've been working diligently with CAT Online and Laurie Stewart and the union around creating a flow chart or resource for you guys on site to use in terms of recognizing when a concussion's happened. And so we're going to talk about that in a moment here. But why it's important to have a protocol on place is you don't want to create what's called a second impact syndrome, which in the long term can actually create that post-concussive syndrome that we're going to talk about in a second. But basically, the second impact syndrome is an individual suffers a concussive impact while still suffering the effect of a previous concussion. And so these results can be catastrophic. Often there's a symptom severity increase. They can be permanent brain damage, paralysis, or even death. And so often that can happen quickly. Often it's over a number of years. And so that second injury can result from even the mildest concussive forces. So you don't need a big injury or a big hit or a big accident for something to happen. It could be pretty straightforward. So making sure that they receive medical clearance to return to work is very important. So we're going to talk about that flow chart in a few slides here. We talked about defining a sport-related concussion, and now in terms of recognizing one, but now when should we suspect a concussion that has occurred? If there's a mechanism of injury and there's one or more signs and symptoms are present, the severity of the sign and symptom doesn't matter, and the onset can be delayed several hours. We want to initiate that concussion treatment quickly, which I'll explain later through the flow chart. Make sure that the participant is removed from the environment immediately and seen by first aid or medical staff on site. So this is what signs observed by staff they will see. They'll be dazed or confused. They'll move clumsily. They'll have delayed responses to questions. They may lose consciousness. And then there could be behavioral personality changes and any type of memory issues where they can't remember things before or they can't remember things afterwards. And these are symptoms that will be reported by the participant. So either a headache or pressure in your head, any nausea or vomiting. So we talked about some of these before. Often people will just say that they just don't feel right and they'll be confused. And so as a potential first aid attendant, they're the ones that might be writing some of these symptoms down. And so this is often how people will report their symptoms. So if you don't have a doctor on site, which most people don't, there are a couple different resources available to you. And these are great guides to recognition and management of these concussions after an event. They're easy to follow. It's a step-by-step process, and it's very easy to use. And so we're going to go through both of these quickly. The first one is that CAT flow chart that I mentioned. So this is the pathway that Laurie Stewart and her group worked with Shalina Baboul and her group at BC Children's Hospital and the BC Injury Research Prevention Unit at CAT, at Concussion Awareness Training Tool online. And they have this response and management for motion picture, film, and live performance industries. And so This is a resource that should be posted at all venues, at all sites. First aid attendants have had training in this and they know how to use it. But basically, if you think a significant impact or motion has happened that should lead to a concussion, then they stop and they call for on-site first aid, they remove from activity, and then they get assessed for red flags. So these are the flags where we want potentially send somebody to the hospital. So if yes to any of the above, then they call an ambulance or they seek immediate medical care, usually at a walk-in clinic or an emergency room or a concussion clinic if that's available. If they have none of these red flags, then you can continue to assess for signs and symptoms of a concussion. So if you're going down on the left here to the yes, then you need to limit, you want to follow your medical advice, and then initially you want to limit screen time and cognitive activity and physical activity. And then after 48 hours, then you can start your return to work protocol, return to activity protocols. If you don't have any of the red flags that I just mentioned, then there's an increased risk of concussion if they are previously recovering from a concussion, if they've experienced persistent concussion symptoms since the incident, or if they have previous history of a concussion. So there's obviously an increased risk of a recurrent concussion at that point. And that would be that second impact syndrome that I was mentioning. And that's actually detrimental long-term on the mental health component because it can lead to complications and other symptoms, which I'll talk about in a few minutes here. I don't want to get ahead of myself. And then with concussion signs and symptoms, so then you would just check mark the ones that they have. If they don't have any symptoms, the performers will be refrained from repeating actions that cause initial impact and or repetitive jarring motions. And for all the other workers, you want to limit physical activity and then advise the worker to watch for signs and symptoms for about 48 hours. If no symptoms observed after 48 hours, which is what I mentioned earlier, then you can return to work, to normal work activity. If yes to any of these above, then you want to seek medical attention. And then if they are observed or if symptoms are observed, then you're back to medical attention. Now, this is a little box that I want to maybe focus on for today's workshop. This is the mental health box. So during the course of a recovery from a concussion, seeking medical advice for any mental health challenges as needed, such as, and these are the main 6 ones that you want to look at. If you are feeling more emotional than usual, if you're feeling more irritable than usual, more sad than usual, nervousness or anxious more than usual, trouble falling asleep, or sad or depression type symptoms, that's when you really want to make sure that you're following up with a healthcare practitioner and you're getting the right help. So I'm going to take a quick drink of water. And then, Will, was there any questions that popped up in the chat while in this first section?
Yeah, actually, just the question that came across was, if you consider that confusion about when somebody might have suffered a concussion has the ability to add to mental health issues later.
Sorry, can you say that one more time? You were just breaking up a little bit.
Does the confusion about when somebody may have suffered a concussion have the opportunity to add to mental health issues that you're talking about?
So when you're unsure if a concussion has actually occurred or not, is that the question?
Yeah, for the person who suffered a possible concussion, and then there's confusion, and does that add to mental health issues?
Yeah, so what we're looking at, usually the mental health component is more of the long-term piece as opposed to short-term. And so the post-concussion syndrome definition is any type of concussion that or symptoms last longer than 6 weeks. So that's where you get into that mental health component long-term. Now, there are some of those mental health components short-term, so that confusion as an example. But if you're looking in the first 48 hours of after an incident, that will be considered an acute concussion. And so any of the symptoms that pop up at that point are the ones that will be addressed initially by the healthcare practitioners. Where you will have that, where you will have those normal symptoms that occur. Now, where that mental piece occurs, that mental health piece occurs, is if you're having challenges or in that long-term piece where those symptoms are actually continuing a little bit longer than usual, but it ends up finding, you end up having to reconnect with maybe a mental health professional at that point to be able to deal with those as you're going through your recovery. And so I'll speak to that a little bit later in terms of that management piece and where those professionals can actually step in, and when those professionals should step in within your concussion recovery. But initially, in that regular recovery time, that 7 to 10 days, most cases will not have any mental health piece or issues. It's really in that longer time period. I was sent another question privately here. Lori, I'll get to your question a little bit later around where can people find the right help. And yes, you are right. Not all doctors or psychologists understand concussion-related mental health issues. Absolutely, I agree with you. But we'll get to that a little bit later.
Great, that's it from me for now.
Perfect, thank you, Will. So in terms of that management piece, so this is the first chart. The second one, I'll go through this a little bit quicker, but this is a concussion incident report. This is just to gather information and get the right information out of. These were created for children as an example for school. These can be easily changed and used in motion pictures situation. Again, those red flag symptoms are the ones that you want to be looking for initially in that initial acute phase of a concussion. So these are these red flags that I mentioned before. So if your headaches are worsening, neck pain, seizures, this is when you want to go to urgent care or emergency. This is done usually acutely in the situation for an acute concussion. In terms of follow-up or management, when you do go see a physician or doctor, anyone with a suspected concussion should always see a physician. If that be at a concussion clinic initially or other, that's fine. It's best to see someone who's trained in concussion management. Now, there are some concussion clinics in Vancouver that have been flagged within the industry for your workers, and so that can be done through your union as well. All that information can be found there. And so the physician will assess different things as you go see them. But for us, what's important here is this neuropsychological testing. Initially, there are some specialists, and one of the questions that was posed was, where's the best place to find those? And I'll have some websites and some resources for you at the end here. So we talked a little bit about all this already, but while symptomatic, you want to try and slow down, or you want to try and limit initially in your first 2 days your physical activity, your mental activity, and your environmental components. This could slow down your recovery. After 48 hours, you can get back into some of these as long as it doesn't aggravate your symptoms. And we'll talk a little bit more about that as we go through our protocols here. So the first one is a return to play or return to sport protocol. So I'm not going to touch a lot on this because this is not really the purpose of the workshop today, but basically you have 6 steps. You want to monitor your participant for about 15 minutes post-exercise on each step. You want 24 hours between each stage. And if there's any new or worsening signs and symptoms that appear, you want to repeat. You want to go back to the previous stage. You may move back a stage more than once during the recovery process. This is kind of what that looks like. It's a 6-stage process. Now, what's important about this is the progression from stage 1 to stage 6. So it's a progressive return to play. There's also a return to work protocol that's been prepared and available, and I'll refer to those a little bit later. and you can find those on the CAT online website. And so what's important to note in this as it relates to mental health is that often athletes or participants that have an issue will not make it very far in these stages because they're having persistent problems and persistent signs and symptoms. And so that's something to think about as you're moving through these progressive return to work or return to activity. Now, some people ask me, is it important to have a baseline test when you're looking at concussions, either acute or long-term? And these are different types of baseline testing. And so my takeaway for baseline testing is it's not required either for youth athletes or people that are not surrounded by medical practitioners that could create or that can implement these tests on a regular basis. There is that recognize and remove messaging right now. And we talked about that flow chart, and that's basically what that is. The concussion recognition tool 5 is basically what the flow chart is based off of, is being able to recognize that there's a concussion that's occurred and being able to step in and pull the participant from the activity that is detrimental for them. And there's appropriate medical assessment and management. Return to sport and return to play or return to work are key in this process. So in terms of mental health, the definition that we're going to use for today is that post-concussion syndrome. So before I go into that, Will, is there any other follow-up questions from that last section?
Nothing new has come by, but it was pretty quick. So if it pops up, I'll let you know.
Yeah, it was very quick. Yeah, it's always weird. Just to give you, I'm used to having a room full of people to play off of and to slow down on certain slides or to speed up or to have a little bit more conversation around certain things. So I'll try and keep it a little bit more interactive if possible. That's always good. So if any questions do pop up, feel free to send those over to Will. Would love to have a conversation around that. So post-concussion syndrome. So the definition is the persistence of concussion symptoms beyond the normal course of recovery. So the first section, I know we went through a lot of information, but I just wanted you guys to understand what a concussion is, how it affects your brain, how it affects your process, your capabilities of processing information, and what to do in those situations and what resources are available to you in your field. I went through the flow chart and I went through the post-concussion, that concussion incident report. And so there's lots of resources around there or around those two where you guys can see and know when a concussion's occurred. And so in terms of today and that mental health piece, we're really looking at situations that are in that post-concussion syndrome component, which is that persistence of the concussion symptoms beyond its normal course of recovery. So as I mentioned, that's 7 to 10 days. Some can take about 2 weeks. But if your signs and symptoms persist greater than 6 weeks, then most healthcare practitioners will probably diagnose that as a post-concussion syndrome. And there's a ton of information on the internet, of course, around post-concussion syndrome and what it entails and different things like that. And so I will be directing you to a few different things. But what I did for today is I actually looked at what the research says around mental health and that post-concussion syndrome and how it impacts athletes and people that are in your field. So that long-term impact around mental health, and we talked about this earlier on your flow chart. These are those. This is the challenges that occur and that pop up the most. People tend to be more emotional than usual. They tend to be more irritable. They tend to be sadder, more nervous. A lot of people will have sleep issues, and a lot of physicians will just medicate to help people sleep, but that's often not the best approach. And obviously there's that depression piece as well. And then doctors, again, that antidepressants to help with those symptoms. And so it's always a interesting conversation, and it's always something that is always a tricky, it's a tricky one to have, because some people, everybody reacts differently with long-term concussion symptoms. And we don't, I'll preface that there is a lot of research that's been done, but there's still a lot of research to be had around mental health and how concussions affect that long-term piece and the long-term health of individuals. So I'm not going to bore you in hundreds and hundreds of pages of research papers, but I've picked out 4 for you, and these are all systematic reviews. And so what that does is a group of researchers get together and they review all the literature around certain things. And so in this case, they looked at the long-term impact of mental health and concussions. So the first one, and I can give, if you guys are interested in reading these, I have them all down on a Word document and cited, so you guys can pick those up if you like, or I can send them to you, no problem. The research says that there's current evidence suggests that there's a link between sport-related concussion and depression symptoms in elite athletes. So there is quite a bit of research around the elite athlete piece, and so that's where a lot of the sport or the concussion research has happened, is that elite or professional level. And in that specific study, they looked at high-level elite athletes in Europe and in North America as well, in different sports, and they found a link in terms of concussion and depression symptoms. So depression was a common one that they found. I'm gonna just quickly, sorry, if you'll, I'm just gonna pull up my research paper here. So most of these are in the Sport Medicine Journal or in the British Journal of Sports Medicine. And so this is what the my little Word document has. And so I'm just going to talk about a few of these. So if you bear with me, I'll just pop back into my PowerPoint here. And so this first one is in the Sport Medicine Journal. And the second one is initially done by the IOC around the International Olympic Committee. And they talked about specifically athletes within the Olympic Committee world, but they looked at, and one of their conclusion was that mental health is an integral dimension of elite athlete well-being and performance and cannot be separated from physical health. Mental health assessment and management in elite athletes should be as commonplace and accessible as their other medical care. Ideally, elite athletes should have access to the best interdisciplinary care. And I would tend to agree. Some of the other research projects, other research papers that I read also mentioned that everyone should have access to interdisciplinary care towards having psychologists and sports psychologists, and even incorporating sports physicians in that, and neuropsychologists to have the most advanced care possible for these long-term concussive type acts or pieces within the sports world. Just a couple more here. This next one looked at former professional athletes. So these were professional athletes that were retired. And so they had, in their reporting, they either, one of their criteria is 4 or 5 sport-related concussions. So if professional athletes have a history of 4 or 5 sport-related concussions, they're nearly 1.5 times more likely to report symptoms of CMD, which is common mental disorders. And athletes with a history of 6 or more sports career-related concussions are 2 to 5 times more likely to report symptoms of common mental disorders. And so if you look at 4 or 5 sport-related concussions, that's a pretty significant amount. By adding just one more, so by adding 6 or more, you're actually doubling, if not tripling, the likelihood of somebody reporting those common mental disorders. And then the last research paper that I found that was a systematic review is that multiple concussions appear to be a risk factor for cognitive impairment and mental health problems in some individuals. Now, there are, and my take-home messaging here is, obviously more research is needed to better understand the prevalence of these chronic traumatic encephalopathy, which is CTE, and other neurological conditions and diseases. Because when you're looking at that post-concussion syndrome, often it'll fall into that CTE category, but that's a little bit separate. It's a separate condition, and so we don't want to share them. But the other neurological conditions and diseases, this is where that post-concussion syndrome comes in. And to the extent to which they are related to concussions and or repetitive neurotrauma sustained in sports. So these are obviously around sports. There wasn't too much around the film industry that I could find, but I feel like it's a very similar environment. And so what the research that's been done within sport can be brought over into that production world as well. And so you can see that there's definitely something to say about the long-term impact on concussions and mental health. People are more likely to represent or are more likely to report symptoms of those types of disorders. But there's also a lot of research that is necessary. And a lot of the papers that I read in preparation for today didn't necessarily come up with any difference at all from people that sustained a concussion and had mental health components or different factors. And some had some as well. I'm not going to deep dive into everything that I found, but they talked about, gender could be an issue or could be a factor. There could be genetics, could be a factor. But I think overall, it's important to think potentially the more concussions that you have over your career, the more likely that you are, studies are showing that you're more likely to report symptoms of these long-term mental disorders in regards to your recovery. So I'll pause here for a second. Will, was there anything that popped up in our chats in terms of questions?
Yeah, actually, based on the research there, the question came across after anything that identified rates of suicide or suicidal tendencies among people who've been identified as having post-concussion syndrome.
Yeah. The piece around, and I actually forgot to put that one in there. My apologies. But the main one is if somebody develops that chronic traumatic encephalopathy, which is CTE. So that's a specific condition where the brain actually creates a very specific protein, and it affects the brain in a very specific way. Athletes and people that have had chronic concussions or repetitive cumulative concussions over a course of a career. And as an example, we'll take NFL. At the start, I had that concussion movie picture, which is a movie that follows or is based on the story of the physician that discovered this CTE in ex-NFL players. And he was an autopsy doctor, I believe in Pittsburgh. And he came across one patient, and he discovered that there was this very specific condition, or this very specific way that the brain was showing itself. And then he got another patient that came through and who had basically the quote unquote the identical brain as the other one. And so looking into the background of those two individuals, he realized that these were both ex-NFL players, and both had, because of this CTE, actually had the ability, or not the ability, but they actually both did commit suicide because of, they basically, for lack of a better term, they basically became crazy because of the trauma that their brain had sustained over the course of their career and then long term. And these guys were not very old. They were maybe between 50 and 60 years old. So this is just maybe 10, 20, 25 years after they were finished their careers as the football players. And the damage that happened in their brain actually created different pathways within their brain and increased their likelihood of that suicide. And so, or even their attempt. And I did go into a little bit of research around that piece as well. And a lot of long-term traumatic brain injury patients, if they're not, the research was showing that if they're not put in the right programs, or if they don't see the right people, if they don't get the help that they need, that's often what ends up happening, is they get into these situations where they do commit suicide or they attempt. And so there's a organization that actually was going to, that I'll speak to on right now. It's a organization based in Burnaby, and they work with trauma or chronic traumatic brain injury patients. So anything 2 years or plus. It's called, where are my notes? Just a second. It's called the Brain Center, and it's based in Burnaby. And they specialize in these chronic or long-term traumatic brain injury patients, and they've had excellent success with their patients. And this is one of those. Places where you want to have that information, or as the resource for yourself or those in your area. So I hope that answers. I know that was a long-winded answer to the question. Was there anything else that popped up, Will?
I think for the time being, it's you've covered it. Thank you for the answer.
You're welcome. And so, sorry, I had the wrong. The resource, or that organization, is actually called the Watson Center. Society for Brain Health. And so I'll refer to them. And so they actually work with those long-term chronic traumatic brain injuries, or TBIs, around, it could be sport, it could be work, however, car accident, however they happen. And so that would be one of those places to touch base with if you are dealing with something like this. Specifically, it's called, so just to reiterate, it's called the Watson Center Society for Brain Health, and it's based in Burnaby. One of the other resources that I'd like to mention is actually just a HealthLink here in BC. They have great resources on websites, but also you can always call, and there's people that are there to talk about situations, and they can refer you to either a psychologist or a physician if that's what you're looking for. There's HealthLink there as well. And then more acutely, or if you are in a situation where you do need to talk to somebody urgently, and you are in that depression state, there is the suicide hotline as well in BC. There's always somebody there that is available to chat with you guys. I know that number has been circulated throughout actually this pandemic season. I know that there's been people that have been hired, and I know that here in Canada, a lot of those online or those hotlines have actually had an significant increase in calls over the last few months. And so that's always a good option as well in terms of resources. Any other questions around research and long-term impacts? So again, there's still lots to be done, but there's a good start there. But so far, we can say that there is current evidence that suggests that sport-related concussion, there's a link between that and depression symptoms in elite athletes, but not only elite athletes, but anybody that is dealing with these long-term type concussion symptoms. This is just a quick little checklist of some myths and mistakes around concussion. In terms of the actual regular information for today, that's going to be almost out. Here are some other resources I just wanted to get to. So on our SportMed BC website, we do have a lot of our concussion management workshop information on there, some different resources, but also we have a directory there, which is a BC practitioner directory. So if you are in BC and you need access to a sports psychologist or a physician or a neuropsychologist, you can find those on our website. The concussion awareness training tool, so that flow chart that I presented on comes from that organization. And so they have a bunch of other resources also around mental health as well. Parachute Canada is the overarching organization here in Canada that oversees harmonization of concussion. And they also have a mental health component within their pieces in their portfolios. The CDC website, specific to concussion, there's the heads up training tool, which is usually geared towards youth. But if you go on their concussion page there, they do have a lot of resources. So if you are from the States, there is that CDC website that has that information. And then the Canadian Concussion Collaborative is the other organization here in Canada that oversees education around concussion. And they are the sport medicine practitioners. And so they'll have all those medical references and documents around that mental health piece as well. So in terms of practical, I think we had 90 minutes. I tried to keep it shorter for you guys as the first day of the conference. Didn't want to spend too much time for you guys this afternoon. I will open the floor up for questions. If there's anything that I didn't answer or that you have questions about, I'd love to chat either through email, which is safetyevents.manager@sportmedbc.com right here, or you can drop me a line on my extension at work, extension 104. I may not answer that line right now, but you can always leave a voicemail and I can get back to you at that point later on after I get your message. So thank you again. I wanted to thank Actsafe for extending the invitation for me to come and speak to you on concussions and mental health. I wish you all the best this week. Enjoy all your workshops and courses and presentations. And if anything that comes up in terms of the concussion piece or sport safety or anything around sport medicine, I would love to help you guys out with that. So that's the way to reach me. If there's any other questions, I'll open the floor for those right now.
The first thing that I just wanted to say is we're getting a lot of thanks for your time coming across in the chat. I don't know if you can see that all, but definitely people who are in attendance are thanking you, and we certainly thank you for your presence. A question that came up was in relation to kind of recognizing that you're moving into the mental health and post-concussion syndrome stage, and that is it more likely that the attending physician or the medical professional will determine that through the recovery process, or is it more like as an individual working at a work site, I'm going to hear somebody who's maybe coming back and not sure about where they are, and I need to kind of be a little bit prepared to answer those questions as well as an individual?
Yeah, that's a good question. I think it's a little bit of both. I think initially that primary care physician will not necessarily have all the information at hand in terms of, oh yes, this is definitely something that you're going to be dealing with. As I said earlier, that those first 2 days, usually the first 2-3 days in that acute phase, you can get a lots of different combination of symptoms and signs around concussion. And so it's really important, at least initially, to give that patient the information around this is how to deal with the concussion. And obviously, you're going to have a follow-up with either that physician or family physician or somebody on site, be it, the first aid attendant or whoever is in charge there. But I think the important piece is for somebody to realize that they're not necessarily, just because they're back at work doesn't mean that they're normal. Things might still be a little bit different. And that's where maybe even colleagues can be helpful, or even checking in with somebody on site and saying, hey, I'm back from, my concussion. I'm still not feeling great. And then just being able to hear somebody talk about maybe some of those, that like anxiety or some of those mental health, quote unquote, symptoms around, I'm feeling more sad than usual, or, I feel a little bit, depressed, or those types of things. So not only realizing it yourself, but if you're around people and you're in that position of at least knowing that information, it's really important that you can even just pull that person aside and say, hey, I realize, that you're back and you have been talking about not feeling normal or having some difficulty. So let's have you follow up with somebody, and then you can go at that point as well.
Great, thank you.
Anand had a question, actually specific to me, so I won't say it out loud.
No, you can say it out loud.
Okay,
if you
sure.
want.
Let's talk.
It was more of an FYI type of a thing if you wanted to discuss it.
Sure.
Because we haven't talked about it since.
Yes, of course, absolutely.
March.
Yeah, so, I'm still new to these private questions or private messaging on chats where I just start talking. I'm like, oh, wait a minute, that's not for everybody. That's just for me. So through Actsafe, SportMed BC, we've been in partnership in developing. We were developing a concussion workshop around the practical applications of giving first aid attendants a little bit more hands-on skills to be able to best manage situations that arise at the work site. But obviously this was all pre-COVID initially in our conversations. And then, the world turned upside down. And so now that the world is sort of spinning back more or less, we're looking at getting back into that conversation. And so likely, probably in the next little while, you'll probably hear a little bit more on this. But Anand and I are probably going to chat about what that looks like, the time frame, and what makes sense given the current landscape around, I don't want to say post-COVID, but let's just say post-COVID, as productions are back up and going. So that's something to look forward to in the future around first aid and how to best manage concussions on site. Good plug there. I wasn't even going to talk about it.
Great. So
if there's, yeah. So again, if there's any follow-up questions, I'll just be here for a few minutes. You can always, as I said, reach out via email or just pop that into the chat box. And so all the best for the rest of your conference, and looking forward to maybe bumping into you guys in real person in the near future. So thank you so much.
Well, thank you, Philip. Looks like our time has come to a close. And if you wanted to learn more about this subject, certainly visit us at actsafe.ca or reach out to Philip directly. We'll have additional resources and links that are available for all of our APE Week presenters and their websites. If you have the opportunity, space is still available for some upcoming sessions, so head on over to the page and register for those that interest you. One of the best ways of dealing with mental health awareness is by showing support to people working to make a difference. And certainly that awareness has increased for me in this session. So on behalf of Philippe Saucier and the Actsafe Safety Association, I want to thank you for joining us today and for supporting our annual Safety Week initiative. Take care and stay safe.